I'm going to be doing my HEENT video. I'm going to scan the room real quick to show that I have no script. Before I enter the room, I'm going to wash my hands, make sure I give the patient privacy, check the chart, and then introduce myself. I'm Alex. I'm going to be your student nurse today. Can I get your name and date of birth?
Shelley Hughes, May 7th, 1987.
All right, and do you know where you are and what date it is?
I'm at the hospital, and it's the 26th of February, and it's Monday.
Okay, so patient is alert and oriented, ×3. She is erect, dressed for the proper occasion. Grooming habits are good. Let's see, what brings you in today?
Just a checkup.
Okay. Are you experiencing any pain?
No.
No? Okay. We're going to start with the head and neck. Are you experiencing any headaches?
No.
Dizziness?
No.
No? Okay. Any neck pain?
No.
Okay. Do you have a family history of headaches?
No.
No? Okay. I'm going to look at the head. Head is normal cephalic. Hair is intact. There are no lesions or scarring. Head has no depressions. I'm going to feel for the temporal pulse, +2 bilaterally. I'm going to check the sinuses, the frontal sinuses, the maxillary. Do you feel any tenderness in either side?
No.
No? Eyebrow distribution is even. Eyelashes are even. The conjunctiva is pink and moist. Let's see. Sclera is white. I'm going to look at the corneas for any opacities. None. Let's see. Pupils are 4 millimeters. Let's see. The pupils are both equal. I'm also going to test accommodating right now. Can you look at that plant for me?
Mm-hmm.
All right. And then can you look at my pen light? All right. And one more time. Can I have you do that one more time? All right. Okay. So eyes are curl up. Now I'm also going to check for any nystagmus with the cardinal gaze. Can you follow my pen light? Okay. I'm going to look at the ears. I'm going to press on the tragus, pull on the pinna, and then check the mastoid process. Ears are symmetrical. No discharge. I'm going to also look in the ear with my pen light. I would normally use an otoscope, and when I would do that, you would see that the tympanic membrane is pearly gray and no perfusions. I'm also going to check the TMJ. Can you open your mouth? All right, close it. One more time, open. Close. Can you move your mouth side to side? Okay. I'm also going to look inside your mouth. Can you open your mouth for me? All right. Lips are pink and moist, as well as the gums and the buccal mucosa. Soft palate is moist. Tongue is pink. Can you open your mouth or say ah? All right. Teeth are white, shiny, evenly distributed. No lesions in the mouth at all. I'm now going to check lymph nodes, preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, the deep cervical chain, the posterior cervical, and the supraclavicular. Lymph nodes are not palpable. I'm also going to check for skin turgor, and there is elasticity. Nose, I'm going to check for patency. Okay. No deviation, no perforation. Nose is symmetrical to the face, as are the eyes. Alright, I'm going to check the cranial nerves. For the first one, I would have the patient smell coffee. And I don't have coffee right now, so we can't really test that. But, so just to make sure that cranial nerve 1 is intact. Cranial nerve 2, I would need a smell chart to make sure, to test your eyes, to make sure cranial nerve 2 is intact. We did Perla, so cranial nerves 3, 4, and 6 are intact. Can you smile for me? About your cheeks. Raise your eyebrows. Alright. Cranial nerve 7 is intact. You can also check with a cotton ball and do certain areas to make sure they have a sensation. I'm going to test your hearing real quick. Sorry. Can you hear that?
Mm-hmm.
Which side?
Right ear.
Right ear. Alright. And then, where's it coming from?
Left ear.
Alright. And how about now?
Neither.
Okay. So cranial nerve 8 is intact. You can also have the patient stand up, close their eyes, and turn to the side. Would you like to demonstrate that as well?
Mm-hmm.
Okay. Alright, close your eyes. Can you turn, or lower to the, tilt to the right? Alright, tilt to the left. Perfect, thank you. Alright, you can sit down. To check cranial nerve 9, is the gag reflex. I'm not going to gag my patient, so but you have to see that that's intact as well. Can you lift your shoulders for me? Okay. So can you also turn your neck from side to side? Okay. Cranial nerve 11 is intact. Can you say light, tight, dynamite?
Light, tight, dynamite.
All right. Can you open your mouth for me too? And stick out your tongue? Okay. Tongue is midline. Thank you. Which means that cranial nerve 12 is intact as well. Let's see. I'm going to look at thyroid. Thyroid is midline. Not, it's normal. Let's say normal. Thyroid is midline, palpable, but not enlarged. Can you spread your arms for me? Alright, so we're abducting the arm. Can you abduct it? Okay. No limited range of motion. Can you invert? Or inversion, flexion. Okay. Can you rotate your wrist? Okay, we have pronation and supination. Can you rotate your wrist for me? Okay, we have no limited range of motion. Can you stand up and walk for me? Okay. Alright, gait is steady, even. Thank you. Gait is trying to think that word. Gait is Gait has direction. Gait is voluntary. There's no involuntary movements. I'm also going to have the patient flex her ankle or move her ankles out. Can you invert them inversion? And then can you invert them for me? Thank you. No limited range of motion in that. Can you put your run your heel down your shin for me? Alright, thank you.
Both sides?
Yes, please. Alright, we're going to test strength as well. Can you squeeze my hands? Okay, strength is great. Can you push on my... Okay. Alright, and now can you lift up? Okay, strength is good in that as well. At this point, I would wash my hands, make sure the patient is back in bed, and tell her to call me if she needs anything with the call light, make sure that's in place, wash my hands, take back the curtain, and leave the room. Okay.
Thank you.
Thank you.